So the gut-brain axis, what is it? Let us have a deep dive into what is the gut-brain axis. It is possible that if you're having intestinal pain or stomach pain, it might not really originate from the stomach. No, this is not any psychology or imagination. It is called a new field of gastroenterology called as neurogastroenterology. It's a very fascinating field. Recent publications in the nature reserves or important journals showed us that there is a concept of an enteric nervous system, that is a nervous system which is connected from the gut to the brain, which helps to modulate or which helps to change how you perceive pain. So if you're under chronic stress, it is possible that you may perceive the slightest amount of pain in your abdomen. Your intestinal movement may slow down or accelerate, leading to various symptoms like diarrhea or constipation. So it is very important to understand this branch of neurogastroenterology or gut-brain axis, which could be the source of many of your problems. So recent articles in Nature Reviews or other journals of gastroenterology show that there is something called as the enteric nervous system. So this has been known to us before, but a lot of research has been done now that there is a connection between your gut and the brain. So any chronic stress or factors can lead to increasing or decreasing the movement of your gut, leading to various symptoms. It can also make you feel pain at a very low threshold, or this is called as visceral hypersensitivity. So this is very important to understand because various diseases, one of the diseases such as irritable bowel syndrome, which you must have heard very commonly. So it is part of this gut-brain axis, and it is a condition in which you may not have any ulcers, or you may not have any bleeding. All your reports and investigations may be normal, but you still have that sensation of pain, bloating, discomfort. So this falls under the category of gut-brain disorders. And it is important to understand that this is a new field, overdeveloping field, and many of your diseases or symptoms could be explained by this. So a lot of this gut and brain interaction is affected by various hormones as well as bacteria. This is what leads to significant worsening of your symptoms. The commonest symptoms being bloating, abdominal fullness, persistent diarrhea or constipation. And these symptoms keep on recurring once you stop the medicines. A combination of diet, lifestyle, medicines, as well as cognitive therapy or behavioral therapy is important to treat disorders of the gut-brain axis. So do visit your doctor to understand more about it if your symptoms are persistent and have not healed even after multiple medicines. So who are the people who are at a high risk to develop disorders of the gut-brain axis? Certain groups of individuals, such as who are chronically stressed or anxious, who are suffering from anxiety disorders, who have recently recovered from a bout of gastroenteritis or a gut infection. They can have prolonged problems of the gut-brain axis. Also, people who have been taking medicines for a longer period for some other ailments. So the long-term use of the medicines can destroy the gut bacteria and lead to the disorders of the gut-brain axis. So the final message is that the gut and the brain are in constant conversation. If there is a distortion of this conversation, symptoms may develop. The future as well as the present of gastroenterological research or scientific research all depends on how much we are able to decode this gut-brain axis. So if your reports are normal and you're having persistent gastro symptoms, it's important to visit a doctor to understand more about the gut-brain axis.